Once the cord is removed, you can see the separation of the hard and soft tissue, and that's what we want to achieve a good impression for this tooth. Patient presents with a emax full coverage crown on tooth number 30, and you can see the buccal surface is somewhat under-contoured, but that's not really the reason why we are going to replace this. The patient states that for over a year since the restoration was seated, she could not chew on the right side of her mouth because of the sensitivity and pain that she experienced each time she bit down right on it. So to remove this emax restoration, which can certainly be difficult when it's bonded in place, I make depth cuts along the buccal surface and occlusal, and then all the way around to the lingual, ensuring that I carefully prep down to the original preparation, and also make a cross from mesial to distal, connecting all of these grooves. So I use a combination of the Zercator diamond burr and also the razor carbide burr to assist with making cuts on each surface of the restoration. And then with a crown removal tool with a twisting action to remove these sections. Once the old restoration is removed, I will begin evaluating the prep and see what areas can be improved upon. With all ceramic restorations, the preparations ideally should have a 1.5 to 2 millimeter occlusal reduction and about 1 millimeter axially with all rounded internal angles. That's really key with these all ceramic materials to ensure that we have a restoration that's well adapted to the prep. Now that the prep is set, I place 2 retraction cores. The first one is a 000 and followed by a larger second cord, size number 2, and that will help displace the tissue away from the preparation laterally. And when everything is set, I'll place a Comprecap. The Comprecap is placed to aid with hemostasis and also to provide additional pressure apically onto the retraction cord to allow some more effectiveness in its placement. Once the cord is removed, you can see the separation of the hard and soft tissue, and that's what we want to achieve a good impression for this tooth. Once the preparation is set, I'll sometimes use a probe or an explorer to run it along the shoulder of the preparation just to ensure that the surfaces are nice and smooth.